Hello and welcome to Health Professional Radio. I'm your host, Neil Howard, and we're going to have a conversation with Serese Marotta. She's a Chief Operating Officer of Families Fighting Flu, or FFF. That's an advocacy organization dedicated to protecting the lives of children and families by raising awareness about the seriousness of the flu. And, of course, raising awareness about the importance of annual flu vaccination. Welcome to the program, Serese. Thank you for joining us here today.
Thank you for having me, Neil.
Now, I did mention, of course, that you're Chief Operating Officer at Families Fighting Flu. Tell us about yourself and talk about why you are involved with Families Fighting Flu.
Sure. Well, I came to Families Fighting Flu back in 2010. Unfortunately, my healthy 5-year-old son, Joseph, passed away from flu in 2009. So about 6 months after his passing, I became aware of this national organization, Families Fighting Flu, and I wanted to get involved pretty immediately following the loss of my son because I wanted to help educate people about the dangers of flu and the importance of vaccination. So I got involved with them, and shortly thereafter, I started volunteering and eventually ended up on the board of directors. I was on the board of directors for several years. And then 3 years ago, I actually came on staff as the Chief Operating Officer.
You mentioned that your healthy 5-year-old son, and very sorry to hear that, passed away as a result of the flu. We've been hearing about the flu our entire lives. We get flu shots every time you turn around. Someone's asking us, do you want a flu shot? Yes or no. It seems to be kind of the norm. Were you shocked to discover that you were dealing with the flu, and were you further shocked at how serious that it became?
I was, absolutely, Neil. I had no idea before my son passed away just how dangerous flu was, because I think we're all so used to hearing, that phrase, oh, it's just the flu. Mm-hmm. And thankfully, most people, when they get the flu, they may become seriously ill and down and out for a couple of weeks, but thankfully, most people recover. Sadly enough, so what most people don't realize is that thousands of people, including healthy children and adults, lose their lives to flu every year. And so that was something that I certainly was not aware of. And when my son passed away, I was very awestruck by, when I started hearing about these statistics. And I just was like, oh my gosh, we have to start talking about this. We have to get people to understand the potential seriousness of flu. And that's really why I got involved with this organization.
When you say the potential seriousness of flu, and I agree with you, it seems kind of the norm to hear about, okay, it's that time of year again, let's all go get a flu shot. What were some of the symptoms that your son was displaying, and were you initially not as concerned? A lot of us aren't as concerned. We think, well, we've got a cold, we've got the sniffles.
Exactly. And that's how my son's illness started. It started very innocently. He was attending kindergarten at the time. He threw up on the school bus. And so, he had the sniffles, he had a cough, he was throwing up intermittently. What really for Joseph became kind of the troubling factor was he became very lethargic. And we ended up calling the pediatrician. They sent us to the local urgent care. And when we got there, his blood oxygen level was very low. So they immediately transported him to the local children's hospital, where initially he was diagnosed with pneumonia. And then it wasn't until several days into his hospital stay, that he was finally diagnosed with influenza. And he was in the hospital a total of 10 days. And I will say for 9 of those 10 days, his condition was relatively stable. For all intents and purposes, we thought, okay, we're here in the ICU of a children's hospital. We're doing our due diligence. He's going to get better, and we're going to go home. Mm-hmm. And things very quickly changed. His condition very quickly deteriorated the last 12 hours. And, essentially there were all these things that were going wrong. They weren't quite sure what was happening, but really not thinking that this was going to be, a life-threatening situation for Joseph. And he suddenly coded, and they worked on him for 35 minutes and were unable to revive him. And what they found after doing an autopsy and going through all of his medical records was that he died from complications of H1N1 influenza.
It sounds to me as if the seriousness was masked by the disease itself, and a little bit of a misdiagnosis, I guess, based on the fact that those symptoms mimic so many other extremely less severe conditions.
Yes, and I think that's the scary thing about flu, and I think most physicians and people in the healthcare professional world will agree, is that you can't really tell whether it's a healthy adult, a healthy child, walks into a doctor's office. We can't really tell, is this the child that's going to recover and be okay, or is this the child that is going to have some serious complications? And I think that's the complexity of influenza, as a disease. We really can't tell who's going to have those complications. And I think that's why, as a parent myself, I always tell other parents, if you know your child best, if you feel something is off, seek medical treatment, be persistent, and just, know the warning signs, know what to look for. I mean, obviously the best thing that we can all do each and every year is get an annual flu vaccination. That is always number one. But there's other things that we can certainly do. We can practice healthy habits, not go out when we're sick. So there are other things that we can do to help, protect public health, because I think that's something else that I want people to realize is that, annual flu vaccination is not just about protecting ourselves as individuals. If we were to go out into the community, it is a possibility that if we were carrying the flu virus, that we could transmit it to someone, and that someone could have secondary complications from that. I always wonder, who was Joseph's patient zero? I don't know that answer. I will never know that answer. But for me, it's really an obligation that I feel not only to help protect myself and my family with that annual flu vaccine, but also to help protect the people that I come into contact with within my own community.
FFF is Families Fighting Flu. Talk about the support that can be found through FFF and some of the support that you received prior to coming on board with FFF. And have any of those resources, have you brought any of those resources with you, some of the support and some of the techniques maybe that pulled you and your family through?
Yeah, so for me, Families Fighting Flu initially was absolutely that support system. There are a lot of families just like mine who have been personally affected. They have either had a loved one pass away from the flu, or they've had a loved one suffer serious medical complications as a result of the flu. So we certainly have a support system. And that is one of the first things that we try to do when we connect with a family that has been affected, is to connect them with someone that they can talk to. As a bereaved parent, I think that was really important for me in the beginning, is I knew I was not alone, that I was not the only one this had happened to. So I was able to connect with someone very quickly and, just get that support that I needed initially. And I think all of us families that are part of this organization really want to help raise awareness. We ultimately, at the end of the day, want to help prevent this from happening to another family. So we really share our stories as part of the narrative, which is so important, because I think there's a lot of people out there, like you said earlier, we're getting bombarded with messages, whether it's the pharmacy or our doctor or the CDC, about how important it is to get an annual flu vaccine. But I will tell you personally, when I go around and share my story, there's always people who come up to me afterwards and say, I had no idea. It really wasn't until I saw you and realized that this is a family. This really happens. So an important part of the work that we do at the organization is sharing our stories.
Well, I understand also that this awareness also incorporates education in the form of materials and website and other support avenues. Talk about briefly some of the support materials. And I understand there's another campaign that you're involved with Keep Flu Out of School. Your baby was in kindergarten, as you say, yeah?
Yes. Yes, on our website, which is familiesfightingflu.org, we do have under our resources tab a lot of educational materials. And you can go on the website, you can order those materials for your school, for your office, for your community center. And we put those out there as a service so that people can help raise awareness with those materials in their communities. So that is absolutely something that we try to do.
And the website, the address for the website? It
is familiesfightingflu.org.
And is that also where we would get information about keep flu out of school? Is that the website as well?
Yes. Yeah, there's a lot of information on our website from family stories, flu facts, about the disease itself, about flu vaccines, there's tailored information for different target demographics for children, adolescents, adults, seniors, pregnant women, people with chronic medical conditions. And there also is information on there about our programs such as Keep Flu Out of School.
Right. Serese, thank you so much for joining us here on Health Professional Radio. It's been a pleasure, and I'm hoping to talk with you again.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcript and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.